Greetings, everyone, and welcome. This is our panel discussion. So this is actually the portion of our event where we're going to be focusing and talking about our proposed strategies for year 2 of our Ending the HIV Epidemic update. And this is focusing on strategies that are planned to be incorporated in Orange County, Florida. My name is Yasmin Andre. My pronouns are she and her, and I work for Heart of Florida United Way, and I'll be moderating our panel discussion today. So I want to welcome everyone for joining me. We have a panel group today that's made up of our EHE funders, our Ending the Epidemic funders, our provider stakeholders, as well as community advocates for HIV, people living with HIV. So I want to go ahead and take a moment to introduce them now. If you could please just state your name, your pronouns, maybe your organization and what role you serve, and who you're here to represent today. So we'll start to my right.
Sure. Hi, my name is Andres Acosta. My pronouns are he, him, his. I first and foremost represent people living with HIV because I am a person living with HIV, and my organization is the Maven Leadership Collective, and the program that I run is Linkages and Lasses. So we focus on training non-HIV specific nonprofits on how they can be more HIV literate and have different access points so that people can get engaged into care.
Hi, I'm Kara Johnson-Williams. I'm with the Florida Department of Health. I'm the Area 7 HIV/AIDS Program Coordinator and the Program Manager.
Hi, my name is Shay Cutliff, she, her pronouns. I am representing today Divas in Dialogue, A Miracle of Love, and I work as a community advocate linking people with HIV testing and care.
Hello, I'm Claudia Jabrudi with the Orange County Government Ryan White Part 8 office, where we coordinate services for people living with HIV.
Hi, my name is Andre Anteno. I'm with Positive Assistance. I'm the president. My pronouns are he, him, and his. So I represent the cisgender Black African American community and Haitian in particular.
Hello, my name is Sam Graper. My pronouns are he, him. I'm also an individual that's living with HIV. I also serve on the Central Florida HIV Planning Council and have for about 6 years now. Thank you.
I am Felipe Sosa Lazabale, and my pronouns are he, him, his. I'm with the City of Orlando, the Office of Multicultural Affairs. I'm the Inclusion, Diversity, and Equity Senior Specialist there.
Thank you, everybody, and welcome again. So I want to start by talking a little bit about the 4 pillars that are involved in ending the epidemic. So the first pillar is our diagnosis pillar. So this is focusing on making sure that we're diagnosing people who are living with HIV as soon as possible so we can rapidly link them to care. And that flows into our next pillar, which is treatment. So making sure that we're treating people who are living with HIV effectively so they can help achieve viral suppression and be retained in their care. And the third pillar focuses on prevention. So this is focusing on interventions that are proven successful, like PrEP, like syringe exchange programs, scaling up on testing so that we can ensure that we're identifying people right away and making sure they get the care they need. And then our fourth pillar is respond. So this is focusing specifically on responding to HIV outbreaks and making sure that we bring care to the people that need it most. So I want to go ahead and start with our first pillar, which we mentioned is Diagnose. Some of the activities that we have planned in Orange County involve expanding HIV testing access in the emergency room, and this involves a collaboration between the Florida Department of Health as well as Orange County Part A office. And this helps to bring ER testing and rapid access to the system of care. A second activity involves addressing HIV stigma and medical mistrust among priority populations in our highly impacted zip codes of Orange County. So I'd like to start by first asking our funders, what approaches does Orange County plan to take in testing for HIV in a busy emergency department?
So first and foremost, I want to state that this was an effort that was done through our community starting back in 2019. We listened to our community as well as looked at the research from those areas that have proven success in reducing rates of HIV. With our approach with busy emergency rooms, we want to go with an opt-out approach. So making sure everyone has access. If you're going through the ER and you're having blood work done, you are also being screened for HIV because we're going to learn to treat this as a chronic illness as all of the other chronic illnesses. So it's just really important that we're providing that access in the ER system because as we know, a lot of individuals may not have access to medical insurance or going to medical care and they utilize the emergency room as a first choice, although we are in the process of changing that. But we want to make sure anyone who comes through those facilities and specifically the ER, they're getting screened for that.
Excellent. And Claudia, could you touch a little bit on the linkage to care piece?
Yeah, so we're fortunate that we are now an recipient of the Ending the HIV Epidemic grant, which is funding that has been allocated to implement innovative strategies that historically we were not able to do before. So, as part of that collaboration with the Florida Department of Health, who is implementing opt out testing, we are going to have an HIV coordinator dedicated to the ER rooms because we really want to use this funding to implement strategies that have been voiced by the community that we have been missing. So we really want to meet the clients where they're diagnosed in order to link them to care faster and improve their retention in care.
Excellent. Thank you. And this next question is for our EHE providers. So, what partnerships are still needed to establish successful linkage to care coordination systems between our community providers and our hospitals?
I believe right now, the CBOs, the community-based organization, they need to work together more. We need to build more constructive financial stability between the CBOs and the hospital. So then those who are educated and who have extensive experience with linking people into care right away and with multiple background, those who speak several languages. So we can use those resources to really get people into care right away because we realize that barriers to care, that something that has to be addressed because when you speak somebody's language, it's easier to link that person into care, regardless if it's at the emergency room or in the community, wherever you are. Speaking the client language is a plus. When you approach the client in their language, they'll feel more comfortable. When you meet your own people, if they speaking the native tongue, so the mother language is a plus. That's the reason we make sure that we collaborate with other agencies that understand the needs, and with that, we believe with all together we can really end the HIV epidemic.
Thank you. Does anybody want to add to that?
I think it kind of piggybacking off of what he said, it's very important to have people who are culturally competent and where you're coming from. Someone who looks like you, talks like you, understands your vernacular. I'm a big proponent of using vernacular with people kind of to level the playing field as far as language, just so they don't feel like you're talking over their head. But then also bringing it back into, well, in the medical field, or you may hear that being referred to as kind of normalizing the language of the things that they'll hear. And kind of breaking that stigma around, discussing your care or discussing a diagnosis or a result. You really have to work around normalizing people taking active conversation or active steps with their diagnosis, their results, or their care.
Thank you. Yeah. So that kind of flows nicely into the next question about how do we reduce stigma and normalize attitudes about HIV testing, especially in our highly impacted communities?
I think it's really important to engage with peer support, to meet people where they're at, being able to engage with someone before they are left to sink into negativity about anything about their medical situation, being able to put people in a better mind space of feeling supported and feeling like the people that they've trusted, their body with are actually engaging them in a way where they are feeling respected.
The city of Orlando is working on a one-of-a-kind community assessment with the Department of Health right now, and our goal is to build out a report that will give us really localized data on how to address stigma at large, HIV stigma, really focusing on the beliefs and feelings. So the stigma component is how you feel inside, right? Sometimes we really talk about the discrimination component, the action that takes place because of the stigma. But really, the stigma component speaks to culture and a culture change that we have to all undergo. But understanding that culture can only change when we address the actual cultural needs of a community, when we have the people who speak the language that people speak, but also people who come from certain communities, right? So they see themselves in the person speaking to them. So our goal is to release this report, and this will drive a lot of the communication work that the city of Orlando will continue to do moving forward on HIV stigma.
Excellent.
Oh,
Go ahead.
if I may, like, one of the things that I've learned from sitting in a lot of these panels where we try to get the information about, like, why are people not linking into care, we have a lot of those answers, right? So we've talked about the fact that we have to engage faith-based communities, that we have to be culturally competent. And so, like, it's great to gather that data, but, like, at this point, we have enough to at least start with the action pieces. So it's starting with those organizations that have nothing to do with HIV, that are already trusted in the community, that don't even have anything to do with the LGBT community. So you're talking about, like, your Christian sharing centers, your Salvation Army, those organizations that are already entrenched, that provide much needed services. And then you go in and you meet those organizations where they're at. So not every organization is going to start doing HIV testing because it just doesn't, it doesn't match their mission. But there's a point where if we meet them where they're at and we give them the tools to at least have the connection to the people that do it testing, then we can build those relationships that we're always talking about building. I think that as someone that is Catholic and that grew up in a Catholic household, my biggest push for this year is to start talking to the Archdiocese of Orlando. Because we might not get them to say, yes, we're going to do HIV testing or promote this or that. But if we can get them to do a unified prayer around World AIDS Day, that is a way that you can literally enter your community where they need to be, and you're meeting them where they're at.
Excellent.
One of the things that we realize from positive assistance that's really stigmatized is the lack of education, the lack of knowledge. So we realize the population is stigmatized because they don't know. So that's one of the reasons with positive assistance, we are providing this piece of knowledge in the patient's native language, in Creole. We make sure that the information is available in their language, and we talk to them in their language so they can have a good understanding of basically what is HIV. So we are on the radio speaking in Creole. We talk about testing, we talk about PrEP, we talk about HIV. Then they start understanding how the HIV is even transmitted. Mm-hmm. So that reducing stigma.
I would also like to add to that, the question is how can we reduce stigma? And, with the Ending the Epidemic plan, you might watch this entire video or not, but the reality is we all have a role to play, whether you're HIV positive or negative, whether you've heard about this issue or not. Every single person in America has a role to play. And if you're just starting with this, the role simply might be asking your doctor, talking to a friend, reaching out to one of the organizations here to get additional education for yourself. If you manage an organization, once again, getting educated to see how it impacts, because it does impact everyone, your organization and the populations that you already serve. So I think the key to this one is to realize that regardless of where you are in the spectrum, whether you're a doctor or you're in the suburbs or wherever you are, all of us actually have a role to play in ending the epidemic. Mm-hmm. And it's a get in where you fit in kind of thing, whether you're reaching out to one of these organizations to get information for your organization, or it's just reaching out for yourself and getting good quality information from the Florida Department of Health website, the Ryan White website, or even the CDC website. I think that the biggest thing I want everyone to take away is that all of us can play a part in the Ending the Epidemic plan.
Thank you.
I just wanted to make a shameless plug. You can find the community assessment at orlando.gov/HIV, and the assessment is translated to Spanish and Haitian Creole.
Thank you. And to Sam's point, we've seen some examples already, with some of the year one activities that we've done with Treatment Works campaigns, making sure that those messages, those faces, those images are on hand sanitizing stations, are on bus shelters, or on all kinds of, areas in the community where people are accessing, there's traffic in those areas, right? Making sure that message is getting out to the communities who need it the most, right? And that it's relevant to them, even if that just means empowering them to know their status. That's step one for everyone.
I think one of the advantages of this funding that our area is receiving is that we really can reduce the stigma associated with HIV by increasing the knowledge of the community about what is HIV, what resources are available. So I think a lot of this funding Orange County is dedicating to that, to increasing awareness on the current resources, on the plan to improve the current status of the community, and just making people aware of what HIV and how HIV is now a chronic disease, and that we just have to treat it that way.
And also, in terms of diagnosing people as quickly as possible, we're providing that access anywhere anyone can access it. So through social media, through, like you said, on the bus shelters, we're going to have an ad on Sunrail that's advocating ending the HIV epidemic. We want to put this where anyone can see this and know the importance of knowing one's status. So while we are focusing on the ER, it's also important that our medical providers understand the importance of routining HIV care. And every time, no matter if you're married, no matter what your current status is, when I'm going in to get checked for my glucose, my blood pressure, all of those different things, I'm also getting screened for HIV, because we need to make sure that we normalize this conversation, make sure that we take the stigma out by normalizing it, making an everyday routine process that, hey, I'm going in to get this screen and I'm also getting screened for HIV. I've been married for almost 10 years now. I get screened every single year. So it's important that we do that piece as well, provide that education.
Thank you. And that flows into some of the strategies that we've talked about making sure that we're addressing medical mistrust, that we're bringing the services to those communities, and really focusing a lot on, understanding beliefs and speaking to those beliefs about HIV for community folks.